Once your jaw surgery is done, there will be some time when your chewing is going to be difficult.
Okay.
So that's because of this
But
reason.
it will be all right. I just
It will eventually be all right, yes, but there will be a time like maybe 2 3 months
3 months.
before this thing settles.
Okay.
And also, I told you about these teeth which
Yes,
are not in
already
proper.
fixed.
Show me that. Yeah, fixed, but can be fixed better, I think. She did it? Or you did it
She
elsewhere?
did it.
She did it.
Yeah. But she's
Um,
gonna do some adjustments on it. She's gonna carve something or something.
Okay.
I don't know.
all right. So whatever that you can do, and later on you might need braces. These teeth are all not in the right position. Can you see?
Yeah.
I'm not going to remove these now,
Okay.
but keep in mind after 6 months or 1 year, these wisdom teeth need to go actually.
Okay. Yeah.
Huh?
Okay.
We're not doing that because then I can't do the osteotomy now.
Okay.
And you get a huge improvement you will get in your angle here. Similar to this patient's picture I just posted recently. I'll just show you that. Almost same thing you can expect. Slightly lesser improvement than this guy, but I'll show you. So you can see his jaw was like locked.
Okay.
See the side view, squarish.
Yeah.
Yours also see the angle.
Yeah.
Now you see what has happened to him after surgery.
Okay.
The length of the face, you see the fullness of the lip.
Okay.
See how your lip was.
Okay.
Yeah. So his changes, you can expect 80-90%, right? Almost like that, not exactly.
Okay.
Not as dramatic as this one, but still dramatic enough.
Okay.
All right.
And what about the lip? There's a curve on my face.
All of that you're going to correct.
Yeah, it's gonna be correct.
Yeah, when we do this, the whole profile improves, and then that severe curving, you can wait for 3 months and put braces. So
what
that will
about
be an
the-
optional choice.
What about the Invisalign? Invisalign is fine, right?
I think it should be fine, but let the orthodontist, the concerned doctor, let them make a call. Should be fine.
Should be fine, right?
But you have to give it 3 months.
Yeah, sure.
Then another thing is, so my assistant doctor, she told me you wanted septoplasty.
Yeah, I don't want to go for rhinoplasty.
So
Just-
we can do the septoplasty, but do remember the shape of the nose will remain the same.
Yeah, that's okay.
Done. Just so that you
The
know.
thing is, like, I don't want to make it more complicated. With harvesting, it's like, no, I don't want to go there.
Okay.
Yeah.
Right. So then we'll just do the septoplasty for you.
Yeah,
And we'll go
septoplasty and Johnson. Again, what are the complications? Like, will
temporary numbness,
only temporary numbness.
that will be there.
Eventually, it's gonna be all right, right?
Yes. Just like the way you feel, you're going to feel eventually. It might take a month, it might take couple
Yeah.
max.
Okay.
The next complication that can happen is some bleeding,
Okay.
because the nerves and the arteries and everything come through there. That will be also maximum bleeding can happen up to 3-4 days after surgery.
Okay.
The next thing is infection,
Okay.
because we're going to use some plates and screws inside. So, infection is always a chance.
Okay.
So that's why we ask you to stay here. That's why we give you antibiotic
I
injections.
can do my best. Like,
Yeah, I think it will happen. I'm just telling you because you want to know what are the complications. These can happen in a very small percentage of patients.
Okay.
And even if it does happen, we can sort it out easily. And the last thing is chewing ability. That I already explained. That was the first thing I told you.
Yeah.
In fact, but that also, if you really look, will be not a side effect, but will be what will happen after the surgery.
Okay.
Your chewing efficiency, chewing difficulty will be there.
Okay.
And as I said, 3 months you could wait and get for braces, orthodontics, Invisalign, whatever suits you, whatever is best for you.
Okay.
The local orthodontist, dentist can be consulted and they can do the best.
Okay.
All right?
But it will be all right for the chewing. I
Yeah.
don't have any pain on it.
Nothing. It will take a while for it to settle, and sometimes, the association of the teeth with the jaws are such that when you move the jaws, the teeth move as well. That's the kind of surgery we're planning for you.
Okay.
So obviously, you can imagine, even if there's a small, like a fraction of a millimeter change, the intercuspations change,
Okay.
and the bite changes, and that takes a while for it to settle again.
Okay.
Second reason is the muscles are detached, because I want to correct this. So when the muscles are detached, it takes a while for it to reattach.
Okay. So you're gonna just cut this portion and move forward, right?
Forwards and downwards, here also we're going to do.
Okay. So my question is like, Is it twisted left side or right
A little
side?
bit.
So you're gonna correct that one. as well?
Everything we're going to
Because
correct.
I want like to be straight line.
Yeah, except the nose, the rest will be straight now.
Yeah.
All right, so we can. When did you have something to eat last?
Last night 10 o'clock.
Cool. So we can start in half an hour, 1 hour, as soon as we can. We start for you soon. Call Anantha Krishnan. Please don't have anything to eat or drink.
No, nothing. That's why I'm not having anything.
Yeah. And thanks for waiting few days.
No.
Because I remember we were supposed to do you 3-4 days ago. And so today is not as chaotic because this is nice. Nice for us, nice for you as well.